Okay. Will you let us know if someone joins? Go ahead and interrupt us so we can just say hello. um, so one thing that I was kind of surprised about, so the myth number one is falling happens to other people, but not me. And so I know, everyone is at risk for falls to some degree, but it was amazing when they asked people, especially older individuals, whether they felt that a fall could happen to them. The majority of people said no. And so, that's just something to kind of think about as we go through this, that this is something that we're going to work on learning more about. So here's a question, true or false? Falling is something normal that happens as you get older. You are correct. That is false. So there are a lot of things that we can do, if you have Parkinson's or if you don't, to prevent falls as we age. So here's another question. If I limit my activity, I won't fall. No, that's correct. That's also false. And another one that goes along with that is that some people believe as long as I stay home, I can avoid falling. And that's also not true, correct? Something that we'll talk about is that, and Kathy found in the research, is that for older individuals, you're more likely to fall in the community because there are different barriers that you run into in the community. But if you have Parkinson's, you're actually more likely to fall in your home. And the reason for that, which we'll talk about, are just the tighter spaces in the home and more turning that happens within the home versus kind of the unobstructed pathways. So something to think about there. So here's a question. Taking medication doesn't increase my risk for falling. Yes, that is false. And it's kind of false and true, I suppose. But when you're on more medications, you can be more likely to fall. But specifically, Parkinson's medications can also, if they're given to you in the right doses, you're working with your doctor on that, they can actually help you by letting you move better so that you're less likely to fall. So it's kind of a false and a true, I suppose. And one last, actually, we'll do two more. Using a walker or cane will make me more dependent. Yeah, so a lot of people want to avoid using a device. And I really think that that's one of those things that you talk to your doctor about, you talk to a physical therapist about to see whether you're safer with the device or without the device, because it really could be either way for every individual. And the last myth is I don't need to talk to my family members or my healthcare providers about fall risks. I don't want to alarm them, and I want to keep my independence. Now, I can imagine that a lot of people do feel that way, but it'll actually make you more independent to have those discussions because everyone is on board with the fact that we want to make everyone as independent as possible in their home and in the communities. So just a few myths to kind of start us out. All right, so we'll go to the next slide. I believe you are up.
I'm up. All right, have a little bit of back and forth. Think of me as a comic relief. Okay, so just statistics can sometimes be daunting. They can, the way we're approaching this is information is power. So by knowing what the risks are and where you are, you can better prepare for them and mitigate those risks. So looking at it, as we all get older, and we've kind of talked about this, you become, or you're not as active. The older you are, unfortunately, you do have an increased risk of falling, with or without Parkinson's. Now, when you combine the older age with Parkinson's, unfortunately, that puts you at a 2 times greater risk for falling. And within those people with Parkinson's disease, we've got 2 different statistics. So it's from 2 different sources, just to kind of give you the range. So somewhere between 45 to 68% of people with Parkinson's will fall this year at some point. We also found one that said that 38% of people living with Parkinson's will fall this year. So 2 different groups, but I mean, you can still see that there is risk involved with that. So we want to make sure you guys have all the information. Of the people who are falling with Parkinson's, somewhere between 50 to 86% of those people are going to fall more than once. Reoccurring, that could be twice, that could be 10 times over the course of the year. When you fall once, it does put you at a greater risk for falling again. So again, we're talking about increased risk of fall happens after 40. As we all get, it's going to happen, including us. So also as your disease progresses, you will also have an increased risk of fall. We have more specific data. We wanted to just give you just general overview of what that is. If you want actual numbers, I will be happy to provide them for you. But really yes, sir. What we're just trying to do is give you that there is a risk, and then we're going to go into the areas in which you're going to have a more increased risk, what causes that, and then how we're going to address each of those issues and how to mitigate your risk of falls. Yes. Definition of a fall that's a very good question. Going to be an unexpected encounter with the ground. Yeah. Mm-hmm. Now, if I had a loss of balance, I would still talk to my doctor about that. So even if you didn't fall, if you have some loss of balance that you were not expecting to have, and you were able to stop yourself, fantastic. However, that may be something that will lead down the road to something else. So if it's not expected, then, and most falls are unexpected, loss of balances, trips, I would still reach out and have that discussion, especially if it's happening frequently. When we'll get to this, the best thing to do is to be honest with your physician and your healthcare providers. If you have a question about something, bring it up. That's what they're there for. They're here to talk you through things and help you figure out a way for you guys to live your best quality of life. So if you don't want to talk to them and say, well, I lost my balance. No, you're absolutely correct though. Mm-hmm. It would be, yeah, you make a good point though. And leading into that, of course, if you do fall, it may mean nothing, but there is also some consequences associated with the fall, which is the reason why we want fall prevention. So obviously you could just have just a scrape. Jane is a great demonstration for us. That you could have some injury, some pain. A lot of people can develop a fear of falling, which is very powerful and can really limit you from wanting to do the things that you want to do, leaving the house, decreasing your mobility, and then just adding to the spiral of increasing your risk of falling. Again, so it kind of leads into all those things. You're decreasing your quality of life by, if you're injured, you have to go to the ED. You could end up in the rehab hospital with Lauren and I, and you could hear about this all the time. Or it also can really increase the burden on your caregiver if you're someone who's really reliant on them. And then there may be a point where you may have to seek alternative assistance for long-term care or something like that if you fall. So we want to prevent all that. We want to keep everybody at home. So by preventing falls, we can keep you out of these situations.
So we're going to talk about three main reasons that people do fall. And so once again, knowledge is power. So we're going to kind of look at the challenges regarding medical, physical and emotional going together, and also environmental, and then really try to give you strategies to empower you to overcome any of those challenges that you might have. So the first one is medical. Thank you, Ken. Okay, and I don't want to get too much into the weeds here. Obviously, we're physical therapists, and each month, different providers will be speaking about different components. Oop, we went too far. That's okay. But just to talk about kind of their link to risk of fall so that you can understand it and maybe have some strategies. So on the medical slide, and also we'll talk about Parkinson's specific on the next slide, it's just important to remember everyone is different. We were all different before diagnosis. Oh, we got the note there. Here we go. I don't know how can we get back to just the slides? There we go. Okay, so it's important to remember that everyone is different. So we were all different before Parkinson's, we age differently, and we're going to experience Parkinson's differently. So some of these things may apply to you and some may apply to others. So changes in cognition. So the way we think can definitely change as we age and also with Parkinson's. And so it's just important to keep our mind active, just the same as we talk about keeping our body active. So everyone can be a bit forgetful sometimes. I hope that's definitely something where I can walk into a room and forget what I was going in there for, something like that. But if you really start to see some changes from what your normal baseline is, that's something you want to talk to the doctor about. There are medications that can help kind of your thinking with Parkinson's, and also speech therapy is also an option to help kind of with those thought processes. You can also put strategies in place to make yourself successful at home. We kind of all do this. We set alarms, write ourselves notes. You can put key information where it's really prevalent in the house, just so that you can kind of make the day easier for you as you go along. The next thing is vision. And so research shows that 78% of individuals with Parkinson's will have one visual symptom. So it may be like slight blurriness. It may be kind of a decrease in the vibrance of colors. It could be a variety of things. Some people will change kind of how they perceive the things that they're seeing or where their body is in space. And so the important part here is just making sure that you're talking to your doctor about it. You can get your vision checked out by an optometrist, ophthalmologist, and just to mention it in case everyone wasn't aware, we also have at least one neuro-ophthalmologist in town as well. And they specifically work with individuals who have neurodiagnoses to look at your vision, knowing the disease process as well. And so you can talk to your doctor about that as well. A couple other things with the vision piece, there are also other resources in town. So there's a low vision doctor if you are having kind of lower visual acuity. And there's also a low vision support group. An occupational therapist can come into your house and do a home assessment and set it up so that you're kind of maximized on how you're using your vision in your home too. So there are a lot of things that go along with that. A side effect of medication can be also hallucinations. I'm not sure if any of you have experienced that before. I will tell you on a personal note, my grandfather did experience hallucinations with his medications. He was in his 90s. And the interesting thing about that was that he would see children playing out in the street outside the window, and it didn't bother him at all. He knew that they were not there, yet he enjoyed watching them play and said it reminded him of his childhood. So I guess the hallucinations aren't necessarily always a terrible thing, but definitely all of those visual symptoms can impact your balance. And so that's really the important part there, is to talk to your doctor and be honest about them. So hearing, we all know that can impact risk of falls. Talk to your doctor if you're having any trouble with your hearing. Picture the dog kind of coming towards you and you're carrying something. Well, you may not hear the dog coming or some other obstacle. The next thing is low blood pressure. So something called orthostatic hypotension can happen with Parkinson's. It can happen with Parkinson's or be a side effect of the medication. But what it is when you go from laying down to sitting up, or you go from sitting to standing, your blood pressure can drop, and it can make you dizzy. So the blood's kind of pooling in your feet with gravity, and so then you can have some dizziness. So if anyone is having that, you can definitely talk to your doctor about it. But one strategy is you wait. So let's say you're laying in bed and you sit up, you feel a little dizzy, have something to hold on to like a bed rail and maybe count to 15. And then when it goes away, you can work on the standing part and then maybe stand there for 15 seconds and then get moving again. So that's one thing. Or you can talk to the doctor about your medications. And they might also recommend some stockings, so some compression stockings, and that'll push the blood kind of back up to your body out of your feet so that you don't get so lightheaded. So medications, we know that, and I think we already discussed it a little bit, but when you're on a lot of medications, it can increase your risk of falling. So they typically say if you're on 4 medications or more, that you are at a higher risk for falling, which is definitely a lot of people. And so it's just important, have regular conversations with your doctors about, am I on the right doses of my medicine and do I need all these medications? And then they can kind of see what you need to be doing and make sure that you're not having too much medication or more than you need. Also supplements. I wasn't going to talk about specific supplements today. That's definitely something you can talk to your providers about. But I would just encourage you to always talk to them about all supplements before taking them. They can definitely impact your risk for falls. We saw this with my father-in-law. He started taking some green tea extract or something and ended up in the emergency room. So solely because of that. So talk to your doctor before you start anything. Stress and fatigue, just wanted to bring that up, that can increase your risk for falls. So think about if you're stressed due to life events or you're not getting enough sleep, you're exhausted. The way that I would kind of encourage you to combat this is just plan your day so that you're not doing the tasks that would require more balance at the times when you're tired or when your medication is kind of in an off time period as well. So kind of plan your day ahead of time, which you may already naturally do. Bone density, just making sure that you have strong bones. That may be something that the doctor wants you to get your bone density checked out. You want to have strong bones to prevent a fall. And then if you fall, you don't want to break a bone. So that's important as well. And just additional medical issues, make sure you're talking to your doctor. I know constipation is very common in individuals with Parkinson's. And so that's something you also want to address so that you're not straining while you're trying to have a bowel movement, which can cause a fall, or rushing to the restroom if the constipation is kind of causing you to have more urinary frequency as well. I know that was a lot of information, but let us know if you have any questions. And then specific to Parkinson's, so once again, some of this may pertain to some of you and not others, but we know that over time, Parkinson's can cause changes in your posture, kind of more of that tilted, stooped posture, which you can see in our gentleman in the picture. Also, your trunk can get a little bit more rigid to where you're not able to kind of turn as well or move your trunk as much. And so it's just really important. You can see the gentleman in the bottom right there. He is very happy about stretching, but just making sure that you're doing stretches to stretch out your back. You can do that with one of the community programs Kathy's going to talk about, or with a physical therapist, but just staying on top of that is a way that you can prevent falls through your posture. So, walking changes, there's a lot to talk about there. So I'll just kind of give us a big overview. We could talk about this for an hour, I assume. But definitely walking changes can contribute to your risk of falling. The one thing is shuffling gait. I'm sure that's something that multiple people have experienced. But the big thing there is if you are the caregiver helping, it's not very helpful to say slow down. That's very difficult to do. But if you say stop, and then once the individual is able to stop, then you say take big steps, that is much more helpful for the way that Parkinson's is processed. And so that's just kind of a helpful hint to help with the shuffling gait. Kathy will talk about this a little bit more, but a lot of the Parkinson's exercise programs really focus on those big movements, big steps, lifting your toes up, those types of things. So also your movement can slow down a little bit. And we know that when you move slower, it's harder to balance for all of us. So that's something to think about. And then some people will have freezing of gait. And so that's when you kind of want to keep going, but your feet kind of feel stuck in place. And so you may still be moving your knees and trying to weight shift and get that step going, but those feet don't really want to move. And so if your trunk is still trying to go, but your feet are stuck, definitely it could lead to a fall forward. And so there are lots of strategies to overcome freezing of gait. We could probably talk about that for an hour too. But the big things are some people do very well with a cue that they listen to that gets their stepping going again. So maybe it's a metronome or a song, or you hum to yourself, or someone says, step to the side or something like that you kind of listen to. Some people do better with a visual cue where they are going to step over their caregiver's foot, or they're going to step. Some people will do like a laser pointer and they'll step toward the laser pointer. So there's listening cues, there's cues that you see, and there's also sensory cues. So it might be something that you use that would cause a vibration to that leg, or if your caregiver kind of helps you shift your weight back and forth more, you can get going again. So there's just a lot of different strategies for that. And like I said, we could talk about that a long time. If you have any more questions, let us know. And then we have, and actually I just want to say also about the walking is the number one thing you can do is just pay attention to walking. So because the basal ganglia is affected in Parkinson's, your brain makes other parts of your brain focus on walking. And it's not as automatic when that part of your brain is focusing on the walking part. So try not to be reading things or thinking about another task or anything when you're walking. Try to just really focus in on what you're doing. So that would be a number one help. And then, as we said, lift your feet up, swing your arms. So these exercise programs, as Kathy will say, will include those big movements. And the other thing we said, turning makes you more at risk for falls. And so if you can do a wide turn, then you're less likely to get kind of frozen or in that shuffling pattern. If you try to turn on the dime, it's a lot more difficult, which a lot of you may already know. So if you can set the house up and do more wide turns, then you're less likely to fall or get frozen. And then body movements is just some of the medications can cause kind of extra movements in your body, and that could throw you off balance. It's not as common, but talk to the doctor about it as well. And then behavioral changes. So we know that Parkinson's at different stages can cause maybe some agitation or irritability. And so making sure that you're doing your movements kind of when you're feeling better is a good idea, because if you're irritable, you don't want caregiver help, you're not being as safe, then you could be more at risk for falls as well. I know that was a lot, but does anyone have any questions?
So now that we've talked about the medical portion of it, we're going to talk a little bit about physical balance and, of course, the fear of falling. All different components of why people fall. So obviously the physical being, Lauren captured a lot of that in terms of the physical manifestations of Parkinson's. So what you can do, obviously, is to remain active. So the Academy College Sports Medicine, they obviously recommend physical activity. They actually recommend for everyone 5 days a week, 30 minutes of a moderate intensity activity and 2 days of strength training. Now, they had an additional recommendation specific for Parkinson's disease. So you want to do that same at least 3 days a week of a moderate to moderate activity, or what was the left? I'm gonna read it because I'm gonna get it wrong. 3 days a week of at least 30 minutes of continuous or intermittent movement at a moderate or a vigorous intensity. Now, the difference between a moderate and a vigorous intensity. So moderate is that you are like a brisk walk, but you can still have a conversation. You can still talk to somebody while you're doing the activity. A vigorous activity is that you are really not able to have like full sentences. You can get a couple words out to kind of dictate. It's not always an activity per se. Like it's not going to be your vigorous walking may be different than somebody else's vigorous walking. But you'll still, whatever your cardio, whatever your heart rate is doing, that can kind of dictate what is considered a moderate or a vigorous activity for you. Does that kind of make sense? Okay. Again, all coming in with different histories prior to Parkinson's and then after. So it all depends. But the big things they also recommend are strength training 2 to 3 times a week. Again, if you are stronger, you're going to have better balance reaction times. You're going to decrease your risk of if someone does bump into you, you're going to be able to balance yourself a little bit better. You're going to be able to get up out of a chair much more easily. As Laura mentioned, eliminating multitasking or trying to minimize it at all possible, working on those high-level balance activities, some agility training. So all that basically means we're not expecting anyone to go out trying out for, American Ninja Warrior or anything like that. It could literally be, agility is just toe taps on top of a box, something that you're really working on the slow, controlled movement of a task. So, or tapping to the side, or standing at the kitchen counter, trying to balance on one foot for a few seconds. So you're really working on those types of activities. Stretching, something that all of us, I can throw myself in this, stretching will definitely help with maintaining your posture, helping keep those leg muscles long and lean to help prevent any injuries or pain from positioning. But daily stretching is actually what you really want to do. You want to do it 2 to 3 times a day to really make a change. You want at least 15 to 20 second stretch of anything to make a change in your muscle length. So you want to make sure that you're hitting all the major muscle groups. And what else do I got? And there's a million ways to do any of these things. You don't have to go and lift weights. You don't have to, there's lots of activities that I'll go on the next slide. But now that I've talked to you about the physical portion of what you need to do, I want to talk to you a little bit about how balance works in your body. So there's 3 major systems that control balance in the human body. One is vision. So if you can see it, you can adjust for it. The other is, I'm going to blank. It's right in there. So I knew it. Somatosensory. So those are your little, they're within your muscles and your ligaments. And it basically tells your brain where that limb is in space. So when I raise my hand, I don't have to look at my hand and know where it is. So it also it's a fantastic system. So actually, as you get stronger and build muscle strength, that will actually get more fine-tuned. And when you're working on those agility tasks, that will make it more reactive. Also auditory. So it tells you when you're upright, laying on your side. So that's why when you get ear infections, you get vertigo or you have other kind of issues, because that really tells your body what's going on. So those 3 systems kind of dictate it. So if you take one of those away, your other systems have to work harder. So I can speak for myself. I have been wearing glasses since I was 7. So I have to rely on my somatosensory and my hearing more to help me when I don't have my glasses on, or contacts in this case, to help me manage my environment because I can't see where everything is. So for Parkinson's, if you have a decrease in your somatosensory reactions, strength, then you have to rely on the others. And of course, it may attack your vision as well. So that leaves you with your auditory. So knowing what you can modify or what you can change and what you can't will help you to address some of the issues that you could have. So Vision, you may, following up with the ophthalmologist, the neuro-ophthalmologist, addressing those issues to help with the balance. Working, exercising, starting maybe with physical therapy or talking to your physician if you've never exercised before. Start there, and they can create programs for you. And auditory, obviously follow up with your primary care to make sure that you are hearing well. Like my dad used to work on an aircraft carrier, can't hear with the lick anymore, but he uses everything else to the best of his ability to keep his balance. Other thing I want to talk about, fear of falling. If you have fallen before, people are very fearful of falling again or injuring themselves. Like we've mentioned, it'll limit them to the point they won't leave their house. They think that if they don't move, they won't fall. And that just, again, gets you into that cycle of continuing to decrease your mobility, decrease strength. It actually also leads to some social isolation, which really has another set of difficulties. So we want to encourage people to move and educate them as to why you need to be moving. There's a great program in town called Matter of Balance that looks specifically at the fear of falling. I know the hospital has a great program for that. It's about 8 classes that you go to and talk about ways that you can mitigate those risks. But it's a very real problem. Some people don't address it head on, but we can obviously help with that. Some of the programs in town, some of the physical ones that you can do, we've got Get Fit with 6 boxing. There's Rock Steady boxing. The senior center has lots of activities. Silver Sneakers, the YWCA, the YMCA. There's a great program that's online we found called Power, and it really looks at the movements that people with Parkinson's have difficulty with. So working on the power of when you go sit to stand, they really focus on the upward movement, looking at your glutes and your back muscles to work on that postural strength. So when you go from sit to stand, you're doing a little squat and you're just going to come up hard and push back. Or it's looking at a rotation to help increase that range of motion and really look through those areas. And they're very simple movements. They don't require weights, things like that. So they're really easy to follow. It's available, again, on Zoom or online. So if you're not someone who wants to go to the gym, there's options for that too. Tai Chi is fantastic for that slow stretching movement, working on big movements. I'm sure some of you have heard of LSBT big. You want to work on big movements, not like the people in the picture. Weights you want to do, but you really want to focus on really getting out there to maintain that range of motion. Because once you've lost it, the range of motion is very difficult to get back, and you may not. So if you have it, maintain it. Big thing, start early. The sooner you know about the process, get exercising, get moving. It'll help increase your it'll increase your independence for longer periods of time. It'll keep you more active, decreasing your risk of falls. So make sure that you are exercising. Of course, I'm going to talk about exercise because I'm a PT. That's what I do. What else am I doing? Yep. So you're increasing your intensity and a salient. So if none of these interest you, you don't have, the big thing I like to tell my patients is find something you enjoy, because then you're going to do it. You're going to stick with it. If you like walking, you go ahead and walk. If you want to go ride a bike, go ride a bike. Stationary bike, you want to there's plenty of water aerobics activities in town. There are plenty of areas that do adaptive sports. If you are having difficult or decreased function and you want to go kayaking, I know great places in town that there's adaptive kayaking that we can work with the movement that you have to get you moving. So whatever it is that interests you, just make sure that you're doing it. I could take that advice for myself. Everyone can. All right. So next I'm going to talk about the environment in your home. So, and these are things that you can modify. So of course, the medical pieces we can't always change, but your home you can. So around your house, everyone's going to tell you, you got to get rid of your throw rugs, right? That's the big one, making sure you're rearranging you've got clear walkways. If you've got lots of cords in an area, and we all have lots of technology that's plugged into the wall, make sure it's tucked away and not out dangling away from the wall. If you have lots of stairs, handrails, inside and outside, footwear, appropriate footwear. So making sure, even though normally I would tell people I want something with a lot of grip, for you guys, I don't want a lot of grip on the bottom of your shoes because that can actually catch your foot and cause you to fall. So something that's supportive, but has less grip. Like a very good example of a brand of shoes. Just a good rubber soled shoe, but not something that there's big, athletic, lots of grip on the bottom. You don't want that. Making sure your furniture is the appropriate height. So a lot of standard dining room chairs are going to be, are maybe too low for you to get up from. So if you've got or worse yet, sofas, because they look high, but then you sit and then you sink in, and that makes it a lot more difficult to get up. So look at your furniture. I'm not telling you to all buy new furniture, but there's modifications that you can do. Putting a firmer cushion on top of it to help you get up. If you don't have a chair with armrests, make sure you get one to help push up from. And if you absolutely need it, there's also lift chairs, but I am a firm believer in not starting there. But if you really want to know the reason why, I'll be happy to explain. Yes. Mm-hmm. Mm-hmm. Perfect. That's a perfect example. That's a perfect example. So look at things before you run out and buy new things to see what we can do to modify. Bathrooms, the majority of falls are going to happen in the bathroom. About 80% of them typically happen in the bathroom. So making sure that you have grab bars where you need them, usually in the shower, maybe right next to the toilet, depending on what your layout looks like. Non-slip surfaces in the shower, outside of the shower. So if you've got a mat, make sure it's got the non-slip grip on it. And then any other durable medical equipment, which I'll kind of go into in the next slide, that you need to help make those modifications. There are accessible homes too. So if that's something that is down the road, something you're looking into, they have all of these already built in and additional things that I will kind of go into. And that's always an option. I'm not sure where they're located in Wilmington, but there are some. Yes. But there's a lot of things that one of my loves is assistive technology. So things that we can't change, what can we do to make it better? And I was telling Lauren today, as I was doing a lot of reading, a positive influence of COVID has been that people are at home more, and they're realizing that we need more opportunities to help people at home. So lots of technology has been coming out to help people age at home, for families to have better communication with them, to be more in tune to what their needs are. And And it's been really, and they're also prices of things are actually coming down. I'm not going to talk about any specific brands, but if you are interested, I will be happy to share with you what I know. So obviously mobility aids, this includes for us, for therapy in general, tub transfer benches, shower or bedside commodes that can sit over the toilet with arm rests that you can push up from. There's also ones that have drop arms if you ever needed to do a squat over to the side. Rolling walkers, canes. This one right here in the lower is called a U walker, specifically for Parkinson's. What it does, the back wheels, if I can, which one was the, I don't know how to read. You told me how to use the thingy. All right, so the back wheels can be calibrated to increase resistance. So if you're afraid of the walker getting away from you, you can adjust that so it doesn't roll away. The walker will not roll until you are squeezing the hand on the handles. So unlike normal ones where people just feel like it's getting away from you, it won't move until you start to squeeze. It also has the ability to play a metronome. If that is something, if you're frozen, it can kind of chime for you. It also can put a laser on the ground, a red line that you can follow if that helps with your freezing. So these are designed specifically for Parkinson's patients. They also have adaptations if you start to lose your upper body strength. There's platforms that you can use as well. Grooming, bathing, obviously I talked about all that shower equipment. We have other safety aids. Obviously, Life Alert, everyone knows that one, and other types of systems that you can call for immediate assistance. There are now sensors that when you walk into a room, the light will go on for you. There's timers that can be set, so it won't be on all night, but it'll chime off in a little bit. There are cameras that if your family wanted to be checking in on you, they could. Obviously, that's up to you. But in some people, it can actually increase by giving up what they feel, giving up a little bit of that. It can actually increase their independence, living alone, and your family just wants to be able to check in on you. There's also programs where family can call and check in on you, whether if they don't notice your motion sense by a certain time, they can be alerted. Again, there's lots of things here. But I can go into technology stuff for a long time. But know that there's a lot of options out there. So if there's any specific, and it can all really be tailored to whatever your needs are to help increase that independence at home. So. Bring us home.
Yes. This is our final information. So we'll be finishing up right at the as planned. And I want to tell you, Kathy's in charge of our technology council at rehab. So she does know a lot about technology in the home if you guys have any questions about it. Yes, she has a very technology savvy husband who I've also used as a resource and stuff. So what do we do if a fall occurs? So we've done all these things to prevent a fall, but what do we do if it actually does happen? Number one, remain calm. So a lot of times it can be a little bit scary if that happens, right? For you or for your loved one. So remain calm, take a few deep breaths. The next thing you want to do is look at your body, try to see if there's any pain or if you have any injuries or anything like that. And the next thing is rest. And I know that's not always intuitive. So immediately if we fall, probably what we want to do is get right back up because you didn't want to have fallen in the first place. But you want to actually just rest, take a few deep breaths, get your energy back. And the next thing is make a plan. So if you're on your own, make a plan of what you're going to use to get up, make a plan of how you're going to do it. If you're with your caregiver, figure out what your plan is together. So you want to hold on to some kind of heavy piece of furniture to get up, something sturdy, right? We don't want to be trying to hold on to something with wheels or an office chair or something like that. If you are by yourself, you don't have any injuries, and you're not near something sturdy, you can crawl to something sturdy. That's also a possibility. If you are injured, don't try to move, right? Unless you have no other way to call for help. So one helpful piece of advice is, let's say you're going to be at home by yourself. You can keep your cell phone in your pocket. Hopefully that's not the pocket you fall on, but you could have it with you at all times. And then if you do need help, you have it with you to call. And if you're more at risk for falling, like Kathy said, you can get one of the medical alert systems. I mean, they used to be, the big necklaces and everything. Now they have watches and all kinds of things that are very simple, and it's not very expensive. I think you can find them for maybe $10 a month monitoring, maybe 15 now. So not anymore. Oh. Oh. Okay. I have looked them up before and found less expensive, but the price may have gone up because the price of everything is going up. Or most things, I should say.
Apple Watch, you can actually call from your phone, from your watch, 911 to come, and that's not it's not specific to fall protection or anything like that. You do have to pay for some service depending on what services you want, but they will all call. So it's another option.
And I'll have to do more investigation now that you've told me this. And so another thing is just, it's really important, and physical therapy can work with you on this too, but caregivers should definitely be trained on how to properly help you up if you have had a fall. So the number one thing that I would tell you is the natural thing to do for a family member is to pull on someone's arm to pull them up. And no matter what, if you're helping your loved one with walking, with sitting to standing, anything like that, you want to have your hands on the trunk. So I'm going to set this down and just this is just very important. So if I was on my hands around her like this, I can control too much from here. I can just hold her under the arm and kind of pull her in different directions. That's important no matter what. I will say, when we teach someone how to get up from a fall at rehab, we use typically what we call the prayer proposal technique. And so what that is, I'll put this down again. So if you go to any questions about what to do if there is a fall? Yes. I fully agree with that. That is a great point. My husband is a firefighter. So if you call, you might see him. He's at the station today. He used to work at rehab hospital, so he knows how to help people up, but they're especially trained to do that, and they do not mind at all. So they don't want to be sitting around the station with nothing to do. They don't want you to fall either, but they're happy to help if you need them. So and then I think it's just that's just it. So I just want to draw attention to the handouts. We won't go through all of them. Obviously, that's something you can read on your own. But there are 6 steps to prevent a fall. We talked about all of those today. And the other thing, this handout here is a questionnaire. And so you read the question on the left side, and then you answer yes or no. And this was created by the National Council on Aging. And as it says at the bottom, if you score 4 points or more, you may be at an increased risk for falling. And so this just gives you kind of some things to think about together. You can do it with your family or on your own. You can show it to your doctor, but it may pinpoint areas where you can work on some of these things and use the strategies to decrease your risk for falls. So if you have any questions after looking it over, also let us know. But we definitely want to thank you so much for letting us come here and spend time with you guys today. Do you have any other questions or feedback? Either way. Oh, sure. I think we do have a We are perfectly fine with you having these slides. Novant Health is requiring us to use this PowerPoint, but we definitely can provide you the information. Yes, Sandra. Okay. Did everyone hear that? So they're recording all of the presentations, and then marketing has to review them. So they're reviewing Dr. Bailey's presentation right now, and then they'll post them on YouTube. And Sandra will let everyone know how to access those. And we'll definitely provide these as well. I guess it's marketing. Okay. Yes. Okay. Sandra says yes. Yes. So Sandra's email is on the flyer, and if you do not have it, she's here as well. If you can ask. Yeah, I think that would be great. And our notes are definitely in the presentation too. So that is true. So okay. All right. So we take just a couple minute break, and then where would you like everyone to be once the break is over? Okay, so it sounds like individuals who have Parkinson's will be over here to have discussions together, and caregivers will be on that side. And if anyone wants to do it differently, you just let us know. Okay, thank you.